Welcome. My name is Dr. Jeffrey Ramirez. I'm a faculty member here in the Department of Nursing. And joining me is Dr. Jane Tiedt, a colleague of mine who is also a qualitative researcher. And so I thought it would be helpful for me to have a conversation with Dr. Tiedt regarding her experience with qualitative research and for you to hear both of our experiences and just in a general conversation so that we could help you understand the value of qualitative research, how it could be translated into nursing practice, and also we're both very passionate about this type of research and hopefully that emerges. So to get started, Jane, why don't you tell us a little bit about yourself?
My name's Jane Tiedt, and I've been here at Gonzaga for 16 years, teaching full-time for 8 years. I just finished my PhD in nursing from Indiana University in Indianapolis, and very quickly went into qualitative research as I started exploring the different research methodologies. Really found that was one that spoke to the questions that I was asking as a researcher.
What do you think drew you to qualitative research?
I find that qualitative research is about the stories, and I love to hear people's stories and their experiences. And so I don't like statistics, I don't like numbers, I don't like math, and so um, found that that moved me away from doing quantitative. And I actually did a quantitative study for my master's thesis, so it's not something I haven't done before.
Yeah.
I just, as I've matured in my professional development and role as a nurse scientist, I find I'm much more drawn to the stories and making sense out of those stories. And when we look at what nursing is, when you look at the paradigms of nursing, the environment, the nurse, the patient, and health, it's really about patients' experiences with an illness or a disease and understanding the responses to that. That's really the essence to me of nursing. And so I find that I really enjoy hearing their stories and making sense out of that lived experience, and that really helps me translate that into becoming a better nurse because I've heard those stories, and it really helps me connect at a relational level with the patients.
Yeah, I'm the same way, and listening to the patient's perception, how they understand or how they're experiencing certain phenomena, whether it's illness or wellness or death and dying or whatever it is, hearing how they're experiencing that whole dynamic that we necessarily cannot put a number to or we can't measure is what I always find fascinating. And my research was in grounded theory. What was yours in?
Mine was phenomenology, and
Oh.
specifically Heideggerian hermeneutics. So it definitely has a philosophical foundation to it. So Heidegger is a German philosopher from the early 1900s that looked at how we experience a phenomena and what is it like to live with X or Y or Z. So in my case, it was what is it like to live with diabetes for Native Americans, and I worked with one of the local tribes to wanted to understand more about their experiences of living with diabetes, because we know in Native Americans they have the highest prevalence of diabetes in the world. And so, there's lots of intervention programs out there, and what we're doing isn't very effective. So, what is it like and Heidegger really looks at the phenomena in the context of their culture, their history, the environment, all those other factors that we think of. You can't take those away when you're interpreting those experiences from the phenomenological perspective.
And then, so phenomenological is looking more at the lived experience.
Yes.
Okay. And with grounded theory, it's really looking at how they make meaning out of those experiences,
Yeah,
which a lot of people do confuse both phenomenological and
right.
grounded theory. And the students have an excellent article to compare and contrast those two
Yeah,
that they just, hopefully they've read by now, but it's in their
yeah.
readings. So tell us a little bit about your research and how did you come up with the idea? How did you, do it? And then also what were some of your brief findings?
Okay, working with Native Americans was a very unique experience because each tribe is a sovereign nation, so they control all dissemination about information, about giving permission to go in and work with the tribes and stuff. So it was a pretty time-intensive process to go through the health board and tribal council to get permission to do a study on a reservation, and working with the community. And so it's important to make connections within the community so you kind of have a gatekeeper that helps you navigate through the system and stuff. I remember right before I was leaving to go to Indianapolis for my first residency, starting my PhD program, I stopped over a friend's house, and she's, I think, half Blackfoot, and several of her family members have diabetes, and so she asked me what I was going to be doing for my dissertation. I said, I really want to do a study with diabetes, and I was at that time kind of intrigued with using all of these electronic gadgets that are coming out to manage diabetes. So I kind of went to Indianapolis thinking that was going to be my focus, and she planted the seed as I was leaving the next day and saying, I really wish you would study diabetes in Native Americans. We need more people studying the Native Americans because, it's killing my people. And so she planted the seed. My husband is also Native American, and on that side of the family, we have several family members that have died from diabetic-related complications and stuff. So that kind of planted the seed, and the first week we were on campus, we did this fishbowl experience where we were sitting in the middle with all of our classmates around us and several of the faculty members kind of asking us questions and helping us process, well, what do you want to study and what is the question that you're asking? And it really became really clear in that process that I was really interested in what is it like to live with diabetes from the Native American perspective. And so they said, okay, you're totally changing your mind. You need to go talk to this person. She's totally into chronic diseases, had been doing a lot of stuff with end-stage renal disease, and she would be a good person to mentor you and be your dissertation chair. So I went to her, and she goes, the question you're asked, that's a Heidegger question. So you need to start learning more about Heidegger. So I spent, several summers immersing myself learning about Heideggerian hermeneutics and, how he perceives the world from a philosophical perspective and what his framework is and how that's used as a method to do qualitative research. So that's kind of how I got into that. It was somebody else planted the seeds.
And that's how I got started in my research, was on men and depression. And then in practice, as a psychiatric nurse practitioner, I continued to see men, and men were referred to me. And I would go down through all the diagnostic criteria. They didn't meet any of it. They would deny that they had this or that. And so then I talked this one gentleman into saying, well, just try an antidepressant. Let's just try it and let's see what happens. And so then he tried it, and he came back within about a month and a half, and he thought I walked on water because he said, I feel like if I'm 20 years old again. I just didn't realize why I was so withdrawn and all these other things. So that generated my idea. And then as I got into the research, because I think that one of the things, and you could give me your opinion, about qualitative research is that we really start with qualitative research when we don't know a whole lot about something.
Yeah.
Because really quantitative is going to get you through interventions and, different types of studies in, along those lines. But when we don't know what people think or how they feel or what they're experiencing, how they make meaning out of it, that's where I think qualitative research fills that gap and gives us a better understanding. Then we can move into quantitative and do some measurements.
And you know, and looking back at, you know, doing some of the lit reviews and stuff, there is a lot of research done on Native Americans with diabetes, but it's predominantly done with the Southwest tribes, where the incidence is, you know, 25 to 50% of the tribal members have diabetes. So, and out of that came a lot of interventions, and yet they're not working, you know, so that made me kind of go back to the drawing board of, you know, what are we missing? And so, you know, I really ask them, you know, what's it like to manage diabetes on a daily basis? And really heard a lot about, you know, how, you know, because I'm a diabetes educator, how my perception of what's important for them to do in their care of their diabetes and managing and juggling diet and exercise and meds and monitoring every day is very different from their experience and all the other stuff that complicates their life, and you know.
Yeah, and it also, I think qualitative research also turns the direction of the medical model, because as health professionals, we think that we have all the scientific knowledge, we think that we know how to fix it, this is what you need to do. And yet, that's what you just described as we're missing the picture. We're missing something here. So let's go talk to the people and listen to what they perceive and what they're experiencing in order for us to fill that gap.
Because as practitioners, we always hear, oh, they're so non-compliant. They're not doing what I'm telling them to do. And so that really puts it in that medical, you know, in some ways very paternalistic model, and they're not entering into that partnership. So I found using that qualitative approach really helped me understand that relationship-based model or focus of care, that, you know, to really develop a plan of care that's in collaboration with your patient changes the frame for how they manage their chronic disease very differently than from a very hierarchical perspective of, you know, I know what's best for you because I'm the diabetes expert. And so I found that qualitative methodology really helped me understand their worldview differently and their experiences of living with diabetes very differently than.
And that's, I shared with you that I'm working on some research on the mentally ill and smoking cessation, and I came across a qualitative study, and it's like we have all of these other studies on why people are not quitting, they're non-compliant, and just labeling them with people's assumptions. And finally, there was a qualitative research in asking them, why do you continue to smoke? What do you get from it? You know, and that just makes everything fall into place, for at least for me, to understand their perception. And then you can develop the right interventions instead of what we think are the right interventions from our own perception.
Because, you know, I've done a lot of studies and coursework and stuff on behavioral change models, and it's not, you know, when you look at a lot of the different models, they talk about, you know, I know that smoking's bad for me, I know that, you know, I know what I need to do to quit smoking. Same way with diabetes, you know, I know eating sugar's bad for me, or I know I should be exercising, I know I should be doing more fruits and vegetables. And it's much more complicated than they've got the knowledge, but it's all these other factors, predisposing factors and environmental conditions, and, you know, that make a difference in that term compliance or adherence, or that we miss without having that.
So how do you think that qualitative research contributes to nursing practice? What do you think it brings to nursing practice?
I really think, you know, for me it brings the stories. And when we look at the results of a qualitative study, it's not, you don't look at, is it generalizable? That's one of the things we talk about with qualitative research findings. They're not reliable, generalizable. But what we do know, or we do want to see is it applicable and useful? So that's where, the so what can I use this in my practice? So that's what I think some of the challenges of a quantitative interventional study is. You've got a set population or a set group you're working with, but it may not translate into working with another group. Whereas when you're looking at a qualitative study and the results of that, it really is a good qualitative study is an aha, wow, I can really use that, or wow, that really changes how I'm going to approach my patients differently because of what I've learned in this study.
Did you find any findings from your qualitative research that you could translate into practice? Can you give us an example?
One of the kind of the subcategories that came out in my study was some real strong patient-provider tensions, really huge gaps in communication. So what we're thinking of what we're doing as culturally competent care, we were not even close, and really gave some new ideas of how to bridge that communication between the patient and the provider, and really the need to, when you're having an interaction with a Native American, to sit and hear their stories and understanding some of their cultural beliefs and values really helped reframe. And going back to the clinic that I've been working with, saying, maybe we could do an intervention study to look at different models of care in this clinical environment, because what we're doing isn't working. That came out very loudly. The individuals at the clinic that had diabetes were given a blue chart. So they're automatically stigmatized for having a blue chart. So even if they went in for a sore throat and only wanted to get treatment for their sore throat or a cut on their arm, they would get grilled about their diabetes self-care. So it was always, I couldn't just go to the doctor. It was, it was always about my diabetes. I could never just be a person. So they became their disease.
Yeah, and that's a key point that's exactly what I was going to say. They were no longer a person. They were a diabetic, which then the disease process overtook. Yeah, interesting. Do you have any other thoughts that you want to share with the students about qualitative research? Because I know that you and I know people get a lot of quantitative, and some people are drawn to quantitative, and we need that. But any other thoughts about the value of qualitative that we haven't talked about?
It's interesting to see a lot of the NIH-funded studies now, or the National Institute of Nursing Research. They're really looking at mixed methods, so they value, even if you're doing a big, huge interventional study or randomized control trial, they still want a piece of that to include qualitative, because there's some richness to that qualitative piece that you're not going to get from quantitative. So it's really, what is the question? What do you want to change in your practice, and is it, is that amenable to doing a qualitative study? Are you going to get better answers from your study participants, even if it's a small study, by asking, some open-ended questions rather than using a questionnaire or something like that?
All right.
So,
anything else?
No.
All right. Well, thank you for your time, and I'm sure the students appreciate it, and thanks.